Hello and welcome to Captains of Industry. I'm Chris Bishop. I'm here in Dubai for this particular show. And with me, I've got a man by the name of Tristan De Boysson, the CEO of Amanat. Now, it's a company that connects investors with opportunities in healthcare and education. Quite a growth area, you might say, in the world at the moment. But thank you very much indeed for joining us. If you could just give me a quick sketch of your business at the top.
I'm the CEO of Amanat. Amanat is an investment company listed in Dubai on the DFM, which is specialized in investing in healthcare and education in the MENA region.
And what size of your business and scale of your business?
We listed at the end of 2014, raised 2.5 billion dirhams, so around $680 million, to invest in these two sectors. Both across the region, and today we have a portfolio of 7 companies, 4 in education and 3 in healthcare.
Just to look into a bit of your background here. Now, you've been working in Dubai for about a year now, but you were in Bahrain before, but you were born and bred in Paris. Just tell us a bit about your family background and how it helped shape you as a captain of industry.
As you say, I was born in Paris and studied in Paris. But then after, I wanted to go abroad, to have my initial work experience abroad. So I spent a few years in Asia, 2 years in South Korea doing my military service. At that time in France, you had to do your military service. So I decided to do it abroad. I worked 3 years in China, visiting clients and going everywhere in China at a time where I was probably one of the few persons having a car to visit my clients. It was mostly bicycles at that time. No high-rise buildings in Shanghai. So it was the late 80s. And then after these years, underground, selling products, I wanted to go back into, doing an MBA. So I did an MBA at INSEAD in 1991, and then I worked in consultancy. I went into McKinsey and Company, based in Paris, spent 5-6 years there, and then went into the business I'm in now, which is private equity investment.
So it must have been interesting in China, I mean, because it only just opened up in that decade, in the 80s, yes. The economy. What sort of sense did you have then as a young man going around China that this was going to be the next economic powerhouse of the world?
I mean, you could see, all these people, these crowds of people who, it was really the beginning of private enterprise. At that time, there were none. The only private enterprise which existed were basically people selling on the markets their food products. And these people were doing very well, selling products and making money, and I could sense quite a lot of anxiety from the people I was working with, which were engineers, head of companies, which were owned by the government. They were not making a lot of money, and they could see these people, which small businesses were thriving, they were making much more. And you could see that this was this transition where people were looking to be able to start their own business, but were not allowed to do it. But then progressively, of course, as you know, it opened completely, and now you have...
And you've been back since, I assume. Yes. What did you feel when you went back?
I went back a few years ago, actually. I was looking at the company potentially to invest. I have an interesting anecdote at that time. I was investing, I wanted to acquire the London Black Cab at that time to develop this black cab in the Middle East, using it as taxis. And at that time, the Black Cab, the company, a company called Manganese Bronze in the UK, wanted to produce and outsource their production in China because it was cheaper. So doing this, I had the opportunity to visit the plant in China, meet and have lunch with the then founder of Geely, which was a Chinese company. And during the lunch, he asked me, Tristan, do you think it would be a good idea to acquire the Volvo cars? And there was this small Chinese company, had this idea of acquiring Volvo car. We had a discussion about this, and then a few months later, here in the newspaper, you could see that he had acquired Volvo cars, and now is one of the major companies in China. So starting from nothing, and the person was about in his early 40s, he started delivering spare parts for HVAC and on his bicycle, and then 20 years later, he was acquiring Volvo.
So incredible times to have lived through. Now, your business itself, just tell us an idea of how the business model works. Now, you look for investor opportunities in healthcare and education. How do you do that?
I mean, we look at private companies that we can invest in. What we want to invest is either strategic minorities or majority. And out of the 4 investments we made last year, 3 were majority transaction and only 1 was a minority investment. The reason for this is because we want to define the strategic agenda of the company. We want to improve operations, so in order to do this, it's much easier if you have majority control, or if you are completely aligned with your co-investors in delivering this strategic agenda. And I would say that it's very it's very important that because we work very closely with this company in order to improve them. So what we do is that we enable investors, because we are a listed company, we enable investors to access private companies that they wouldn't have access otherwise. So we invest in these companies, we improve these companies, we try to grow them as platform, make add-on acquisitions, and then ultimately either we can exit or we can hold, and our shareholders get the liquidity by selling their shares, trading their shares, and the growth in value of our portfolio company should ultimately be reflected in the share price of our stock.
Okay, so that's how it works. So a lot of people might say that, well, if you have money, a company will find you eventually. I mean, why is it that they need your company in particular? Or what role do you play that's unique?
The first thing is we improve the corporate governance of the company. Many of the companies we invest in are family-owned businesses. Ultimately, they would like, for example, to list their companies, and we can help them institutionalize their business, improve the transparency, strengthen the board. So all these, as an institution, we can bring to the companies we invest in order to, as they reach, the next stage of their growth, we can bring to them. The second thing is, from a financial point of view, we can help them make add-on acquisition, as we want to grow them either organically or through acquisition. We have the team to help them identify these acquisition opportunities and then execute the transaction. And very recently, a few months ago, we helped one of our companies in Jeddah called IMC. It's a large, tertiary hospital, acquire a number of clinics in North Jeddah, and we led this effort in making these acquisitions. So that's something we bring to the companies. Also, we can help them, finance and raise debt from bankers, because these are people we very regularly work with. And then the final thing is helping them initiate and implement some operational improvement. Many of us are ex either consultant like myself, or ex doctors or still doctors, but can help them. So what we try to do is really bring our operational expertise in order to help them achieve their goal faster.
And what kind of appetite is there for investment at the moment? Bearing in mind we're living in very edgy times, everything from the coronavirus to a diminishing pool of capital around the world. How are you approaching this?
I mean, we are fortunate to invest in two sectors, education and healthcare, which are both resilient, but with strong growth prospects. And in more turbulent times, it's very attractive for investors to invest in sectors which have these two characteristics. So in case of a downturn, they're very resilient, but because of population growth, because of the high incidence of lifestyle diseases, there is very strong growth prospects going forward. So I would say that for our industry and for the sectors we focus on in this region, the prospects are actually pretty bright.
You mentioned lifestyle diseases there. How could you define that exactly? Seems to me a bit of a vague term, but I mean, how is that attracting investment?
I mean, these are diseases that are the consequence of the kind of life we live more and more, which is more sedentary, people not exercising as much as they should, the eating habits which are not as good as they should be, and that's especially true in this region in the Middle East. And if you look at the incidence of diabetes, for example, you have 20% incidence in the Middle East compared with 10% in the US, 5% in the UK. If you take obesity, it's 35% in the Middle East. It's 20% in the West. So and these kind of disease cause a number of health issues, cardiovascular issue, cancer issues. So so this is what's driving the growth of healthcare in the region. Education is also have some very positive trends. The population is growing, but the other thing is that there is an increasing middle class, which is willing and able to put their children in private education, because private education tend to have better outcomes than public one. So this is driving this shift to private education, from public education to private education, and the growth of the population also help the growth of education, private sector we invest in the region.
Okay, hold that thought there. You're watching Captains of Industry. I'm Chris Bishop here in Dubai. I'm with Tristan De Boysson, the CEO of Amanat, an investment company that specializes in connecting investors with education and health projects. We're talking a lot more about expansion plans and other things in the second half. Do stay with us. You're watching Captains of Industry. I'm Chris Bishop here in Dubai, and with me I've got Tristan De Boysson, the CEO of Amanat. It's a company that connects investors with projects in education and health. Just to continue our conversation in the first half, you're looking for expansion plans at the moment. Whereabouts are you looking in your outlook?
Our main focus is MENA region, including Egypt. So currently we have these 7 investments in UAE, Saudi Arabia and Bahrain, but Egypt is one of the countries we're looking at, both in education and healthcare.
Why Egypt?
I mean, Egypt, you have population growth is very important, and so the prospects for growth in Egypt for healthcare and education are actually higher than in the Middle East. But also there is, in terms of supply, supply is lagging, and so the number of universities is still too small for the demand. So as we speak in Egypt, there are universities of tens of thousands of potential students which are being built. So there's a lot of growth potential there.
How likely is it you might look further south towards sub-Saharan Africa?
Currently, these are not the plans. I mean, we may invest as part of our mandate also in North Africa, but in sub-Saharan Africa, it's not currently our focus. This being said, we are constantly looking for opportunities. At some point in time, we may increase our capital. We may decide to go there, but then of course, this would require the full consent of our board and our shareholders.
What are the big difficulties in your business?
I would say that two, in healthcare. One is the rising cost of healthcare. It's becoming more and more expensive at a time where the governments want to reduce the burden of care on the economy. So it's a challenge, and that's why we have to use all techniques in order to lower the cost base, in order to provide the best kind of healthcare, but at the lowest possible price. So that one challenge is to contain the cost of healthcare. Second challenge is to attract talents, to find good doctors willing to come to the region. So the search of talent and the ability to attract them is actually critical. And that's why we believe at Amanat that we need to invest in platforms which have the scale and the ability to specialize, because they can keep the patient from primary care to tertiary care, so that you have the volume in order to attract these doctors. Because doctors, they go to places where either they can do research or they can practice their skills. And to practice their skills, they need volume. And only hospital groups with this kind of scale can provide these volumes and attract the best talent.
And this at a time in many of the countries you're dealing with when there's an increasing aging population as well, which is also putting a heavy burden. Is that seen as an attractant for investments, you think?
Aging population is a key driver for healthcare. It's a key driver everywhere in the world, but it's even more pronounced in the Gulf. If you look at the growth of aged people in the UAE, for example, it's 15% now. They start from a low base, but the growth rate of this population is actually much bigger than in the West. And they also live longer, and they will require more and more care.
And also talking about the aging population, what about this issue of medical tourism? I wrote a story about Mauritius not too many years ago, saying they were trying to get into the market. It's a tough market, but it's a very lucrative one. Mm-hmm. Are you seeing investors eager for that, for people to have operations and go spend the rest of the time on the beach, or what?
I think, medical tourism is one of the key objectives of the governments, in this region, is to attract, medical tourists. It used to be the other way around. Many people from this region used to go abroad, and it's still the case. And it's probably, a few years ago, it was $12 billion of spend by the government, paying for their population to have the care abroad. Now they are trying to reverse this thing, and the only way you can do it is by investing in your own healthcare system to not only keep these people who are otherwise traveling outside, but also be a healthcare hub which can attract medical tourists. And it's a very strong way, and it's a very big driver of diversification out of the oil industry.
What about other issues that you're facing in the countries where you do get investors to? Healthcare and education are very emotive issues, politically emotive issues in most countries. Do you get any resistance at all from the lawmakers bringing in investment from outside?
On the contrary, I think the regulator is really helping private operators to help them invest. They are helping us in different ways. For example, one way is to make compulsory insurance for healthcare. So this is being rolled out across the region. So more and more people will have access, expatriates will have access to healthcare. So this enables to grow the number of patients. Another way is through PPP. They want to privatize some of their operation. They want to shift the burden of care from the public sector, which is still 75% of the healthcare in this region, to the private sector. And the reason is because the private sector tends to be more efficient than the public sector. And as a consequence, the cost should be lower if it in the private sector hands.
What about the fourth industrial revolution? It's been talked about for many years at places like the World Economic Forum. It's now buzzwords for many politicians. But how can it change the face of the two main areas, health and education, that you bring investors to?
I mean, in healthcare, I mentioned before the challenge of providing better outcomes, but at the same time lowering the cost base. Digitalization can help close this gap. You can, for example, if you take imaging of it used to be and still doctors looking at images and coming to a conclusion whether how to read it. Now you have techniques where it's with artificial intelligence. It can be completely automatized. The outcome is much better. I mean, and the success rate is much better than for a doctor. And also, it can be done remotely. So if you are in a remote place in Africa or in Saudi Arabia, you don't have access to these doctors. But with these machines, you can transfer the data automatically, and then you have an expert sitting somewhere in Johannesburg or somewhere in Riyadh, analyzing it, and then it's returned back. So the quality of the assessment is much better, and the cost is also much smaller because the machine can read many of these images much faster than any person. So that's one area. Another area is all the wearables that people have. Then you can intervene much earlier if you see that you have potentially a problem, instead of waiting for the problem to happen and then curing it. The cost is much more expensive. So that's another way to lower the cost base. Another way could be for home care. People can stay at home being monitored by these machines instead of staying in a hospital where the cost is much higher.
And where do you think it's going in the next 5-10 years? I mean, from your research, what sort of things might we be doing in schools and hospitals that we can't even dream of now?
I think one day what may happen is that instead of reimbursing for the cost of provision of a service, so I mean you go to a hospital, the hospital, you have an operation, and then the hospital charge the insurance company or the government for the cost of this operation. You can imagine a world where the insurance company or the government will tell one hospital group, you take care of this population, and then we pay you a fixed price for this population. Now you have to get all the data from this population, you have to intervene early enough, you have to invest in preventive healthcare, but it's a fixed price, so you take care of this population. So I mean, with artificial intelligence, with the right kind of tools, you can imagine this kind of world.
And just lastly, we're coming to the end of the interview now, sadly, but lastly, what is your vision for your business? The world is going through very, very tough times, as I mentioned earlier, but where are your eyes fixed on the horizon?
I mean, our vision is to develop entities, platform, which have the ability to bring the scale, the expertise in order to improve the outcome for the general population. I mean, these two sectors, healthcare and education, are, I believe, not only very good sectors for investment because of this resilience and potential for growth, but it's also very good for society. And at a time where more and more companies are trying to do the best for the society as a whole, and not only to the shareholders, but for all stakeholders, I think we as Amanat have a role to play, being in these two sectors.
Thank you very much indeed, and best of luck in all your endeavours.
Thank you, Chris.
Thank you. That's Tristan De Boysson, the CEO of Amanat, a company that connects investors with opportunities in healthcare and education. I'm afraid that's all we've got time for this edition of Captains of Industry from Dubai. From me, Chris Bishop, it's goodbye.